The Medicaid program is a U.S. healthcare program that takes care of our most vulnerable populations. Populations like low-income children, low-income families, disabled people, frail elderly people. And we work with those different programmatic areas to understand the services that are delivered and how much they cost. We work long and we work hard, and it's not just for the paycheck or it's not just to complete a project, it's for a reason. And it feels better when it's a reason that you're really passionate about. My older brother Dan has autism, and we shared a room for the first 18 years of our lives. Dan's kind of the classic guy with autism. He doesn't speak a lot, and when he speaks, it's mostly in repetitive words that mean something to him, and by this time mean something to us too, that know and love him. But to the average person, they may not mean anything. He's generally good-natured. He likes to be outside. He likes to be with people on his own terms sometimes. He has routines, and if that routine is knocked a little off kilter, that can create some behaviors that make it a struggle to fit into society. One of the things about people with disabilities is they don't want anything different out of life than somebody who doesn't have those disabilities. It's just much harder for them to attain those goals. People with disabilities like my brother, they want a place of their own to live. They want a rewarding job. They want to live independently and feel like they contribute to society. But the factors inside of them and the disabilities inside them make it really hard to do that without supports. He, of course, gets medical care through both Medicare and Medicaid, and it's a very important safety net program in the United States, and I'm proud to help my clients understand the financial consequences of policy decisions and ultimately help them develop the best program they can to care for the population that they're charged with caring for. Dan being in my life has made me understand the needs of people with disabilities on a very personal level rather than a theoretical level.
Where do you want to go for lunch today? I think Rivera's might have fish.
Fish.
I think it's easy to think you can put yourself in somebody's shoes and understand what they need, what they're thinking, how they react to things, but to live with somebody on an everyday basis and witness the struggles and successes that my brothers had made me more empathetic on a more personal level to the needs of a population that historically has been underserved by a lot of systems. And I'm always amazed in working with state Medicaid directors and other leadership in state Medicaid agencies, really how much they care about the populations and how much good that they want to do for the people that they serve. I mean, one of the reasons that I really enjoy working for state Medicaid agencies and have really devoted most of my 25-year career to it is that I think the program really makes a difference in people's lives. And if for whatever reason, if I would have been in the position of my brother and he would have been in my position, I would want him to help too.